Crisis Services, and this is Elizabeth Nieves. And I bet you're really glad that we're here because we are the last team to go. We're in Chatham County, and this is a picture of our lovely staff here. Most of us anyway. And
I'm not in the picture. It's not as lovely as it could be.
We're a pretty comprehensive domestic violence and sexual assault services, and we provide all the usual services. That we have a crisis response, a shelter, court advocacy, legal services, counseling and support group. We have some long-term services. We have community outreach. We have a coordinated community response project. We have some primary prevention programs, and actually used a capstone team 2 years ago to help with our primary prevention program. But I bet we're the only domestic violence and sexual assault program in the state of North Carolina that has hosted a wedding on site. And two weeks ago we did, from one of our survivors who's now on our board, who said, this is the place I put my life back together and was able to feel like I was worthy of being loved again. This is where I want to get married again. And so we hosted her wedding 2 weeks ago. So, well, I think it's on to you.
Oh, it's me. Okay, so since our capstone project revolves around our SADIE project that we're involved in, I'm going to tell you a little bit about SADIE. SADIE is a national sexual assault demonstration initiative, and what that means is that historically, well, most of the sexual assault services in the country are at dual agency or multi-service agencies, which is what we are, as Kathy just explained. And in those agencies, most of the time, the sexual assault services are not up to the same level as the domestic violence services. And so SADIE, the Office of Violence Against Women, has this pilot project that has 6 sites across the country, and those sites are like radically different. Each one is in a very different community. One is an Indian reservation, a Native American Indian reservation. The other one, another site is the Asian Women's Center in New York City, and then we're one of the sites as well. And but they're all dual agencies in these different environments. And so what this project is about, and it was really competitive, by the way. So we're really proud that we're one of these pilot sites, and we're really excited, and we want you to feel that excitement. But SADIE's goals are to increase outreach to populations experiencing sexual assault in their communities but not currently accessing those services, to develop models of service provision that prioritize the needs of sexual assault survivors, and to assess efficacy and steps in increasing numbers and types of sexual assault survivors who access those newly enhanced services. And what's really important about this is that the models that work, they keep telling us we're building the plane as we're flying it, which is what we're doing. And we've already, each of these sites are doing this assessment in their community, which we've already done that. And we've put together our plan, and we're going to begin implementing that plan. But what's really important is what works. We're trying to figure out what works and what doesn't. What works is going to be implemented across the country in communities like ours. So that's really incredibly exciting.
We've spent the past 1.5 years working on our plan,
and
we are our assessment and our plan. We finally are getting it through the approval process, and hopefully it'll be approved this coming week.
So our specific plan, I'm just going to give you the highlights of our specific plan, are to train our staff to provide effective sexual assault services through a trauma-informed and anti-oppression lens, to improve our infrastructure to provide effective sexual assault services, to expand services for survivors of sexual violence, to enhance community outreach strategies, and enhance capacity of community partners like law enforcement, prosecution, those types of community partners, to serve survivors of sexual violence. So it's a very large picture and a big plan.
Yeah. And our plan's a couple of years long, but what we would really like help with you guys in doing is some of the things that we're going to be doing in the next year. And so one of the things that we want to develop out of this is a compendium of best practices and model policies and programs. As you know, as Elizabeth said, we're going to be doing a lot of policy revision and trying to make our policies really effective for trauma-informed work. And so we want some help in doing research about what the best practices are in the country and what other people know about doing trauma-informed services. We're also going to look for you to help with some with our evaluation of our services. We think we're good at providing services. We're not so good at doing evaluation. So we would really like some help with that. And so we want the Capstone team to develop a compendium of program evaluation tools and then some training materials for us, training us on how to use those tools effectively. So those are important pieces of it. Another part of the plan we want you guys to help us with is our outreach and awareness plans that we're doing. And you'll have the opportunity to help develop a community outreach plan for the general community to make sure they know about our services and how they work and dispel some of the myths that we identified in our assessment. And also have a targeted outreach plan for youth and young adults. We're really going to try to focus on that population because we know they're high risk and because we don't think they're accessing our services at the rate at which they should be. So some of the things we think you'll gain by working with us is an understanding of organizational policy and best practices in sexual assault, some evaluation development, training skills and experience, community development skills, experience in testing messages and materials, and we actually have the funds to produce the materials, so you'll have that to take with you. Opportunity to participate in agency training, and a chance to be part of a collaborative national demonstration project.
Those were sort of the tangible things, and there's some intangible things as well. And the thing that comes to my mind is I had an intern work with us a few years ago, and she was from this lovely school, and came with this idea of sort of what social work was all about. And she participated in a project with me at the high school where we work with teen victims of sexual violence and other types of intimate partner violence. And she every time we met with these kids, she would say, okay, now like, what's the plan? And I'd say, well, the plan is to respond to their needs. And she's like, I'm not real comfortable with that. But she grew so much, and at the end of it, the kids like totally fell in love with her, and she totally fell in love with them. And so that's one of the intangibles. And the other thing is we dance a lot. So, and we drink coffee.
Every chance we get.
And we drink